Here on September 16th, the city of Richmond remains in phase 3 of Governor Northam's Ford, Virginia reopening plan. And the local government here in the great city of Richmond continues to be in phase 3 of our operating procedures as well. If you have any questions about city services that you may need to access during this pandemic, we ask that you reach out to us at richmondgov.com/COVID-19. richmondgov.com/COVID-19. And if you are unclear how Fort Virginia may affect your business or the places that you may patronize, we ask that you visit rvastrong.org/reopening guidance. rvastrong.org/reopening guidance. As of this morning, the Richmond City Health District is reporting 4,384 total positive cases in the city of Richmond since the beginning of the pandemic. 55 Richmond residents have lost their lives due to this disease. As I've requested in past weeks, today I request that we take a moment of silence for those who we've lost. Thank you. As a recommendation that comes down from the Commonwealth of Virginia and the Virginia Department of Health, and also something I recommend to all of our residents as well, we ask that you download the COVID-Wise application to your smartphones. There you can get notifications of exposure. And then when you do receive one of those notifications, there are plenty of testing events available, options available to the general public. There will be a testing event on Thursday, September 17th at the Robinson Theater in the East End. On Tuesday, September 22nd, there will be a testing event at the Neighborhood Resource Center in Greater Fulton. That one will be from 4 to 6 p.m. On Thursday, September 24th, there will also be another one at the Neighborhood Resource Center in Greater Fulton from 4 to 6, and also in the Randolph community, at the Randolph Community Center from 9 to 11 a.m. These events all in the city of Richmond limits. Remember, these Richmond City Health District events are available to the broad public, regardless of insurance, citizen status, mobility, or geographic location. And if it would make you or your family or your friends more comfortable, we still request that you go get tested. Wearing a mask, getting tested, some of the best things you can do for all of us to survive this pandemic. Also, if you do need a mask, or you see someone who needs a mask, we ask that you visit rvastrong.org/get-a-mask and be a part of our mask network where we're providing free masks to the public. Today, I am providing an update on the city's emergency child care initiative. The sites I announced last week are already full and have already developed waiting lists. Need is demonstrably high, and the sooner Richmond Public Schools enters into an agreement with child care providers to use RPS facilities, the sooner these families will have access to this critical care. That's why I, along with some of my colleagues on City Council, am sending a letter later this week to the Richmond School Board, asking them to follow through on their agreement to partner with us. To be clear, we are not asking them to assume any additional liability or to run the programs. The city and providers are dedicated to doing exactly that. We are asking them to use the same approach we use for our after-school programming for full-day child care as well. As you know, this administration, partnering with a number of nonprofit partners in the past, we have been able to expand after-school programming to each elementary schooler, each middle schooler in the city of Richmond. We're asking to essentially follow that same model for emergency child care. Standing up centers in schools allows us to serve more kids at fewer sites. It's an economies of scale thing, which in turn will allow us to support more child care providers in churches and community organizations throughout the greater city. This, to me, is the fastest, most efficient way to get kids into child care safely. And let's use the models we already know how to use to make this happen. No need to reinvent the wheel. We know that to make emergency child care truly accessible, we have to support existing providers all across the city. Providers who are currently serving small numbers of kids but have the space and staff to safely serve more. These providers are trusted voices in the community, neighborhood caretakers who have already established their care for our Richmond kids. So, today, I'm also announcing that we'll make $1 million worth of CARES Act funding available to support these neighborhood-based providers operating out of churches and other community organizations throughout the city. The application will be available on Friday. When providers apply, we'll need to see your liability insurance, your operating plans, your budget, and more to ensure that you can, in fact, serve more kids and should be getting public funds to do so. These funds will strengthen our neighborhood child care providers network. If you are a provider or know of a provider that could help us get more kids safely in care, point them to us, point them in our direction, and point them to this program. More information will be coming from the city communications team when the application becomes available. In the meantime, we ask that you check out Help One RVA to find facilitated learning centers throughout the city. Yesterday, the city announced that it is now projecting a $13.75 million surplus at the close of fiscal year 2020. And that is due to the cost-saving measures and conservative revenue forecasting in the early stages of the pandemic. This means that we were projecting financial health, closing out a really challenging time for the entire city. The work of this was done by our finance team, led by our Chief Administrative Officer, our Acting Chief Administrative Officer, Lenora Reed, John Wack in finance as well, Dr. Jay Brown in budgeting too. The entire team was involved in this effort. Ladies and gentlemen, this is a good sign. 50% of the calculated surplus has to go to our rainy day fund. 40% must go to the capital maintenance reserve. And the remaining 10% will go to something called the special purpose reserve. Now, I am recommending we use those special purposes funds to do three things: catch up on the post-employment benefits for retired Richmonders who have served the city government. 2, help fund the equity study championed by council members Cynthia Newbill and Ellen Robertson, and address a challenge in our city that has only become more apparent and has been illuminated during this pandemic, and that is that of health disparities. We've In Richmond, the pandemic has hurt us all. We've recognized that. But some, due to systemic oppression, racism, have borne the brunt, namely our Black and Latino, immigrant, and LGBTQ plus Richmonders. We've named this from the beginning and designed relief programs targeted to those communities. I'm very proud of that. Programs like mass distribution and housing grants for immigrant families. Now it's time to permanently build out our infrastructure to address this ongoing inequity. So, we will use $500,000 in special purpose funds to to creatively address health disparities in Richmond. That's $500,000 in special purpose funds to create and address, creatively address health disparity issues in the city of Richmond. And with that, I'll ask Dr. Avula to come up and give an update on the state of health here in the great city of Richmond. Dr. Avula.
All right, good afternoon, everyone. As we have been for the last few weeks in the central region, which encompasses the city of Richmond, some of the surrounding counties, but actually extends all the way down to the North Carolina state line, that entire central region has continued to have a high burden of disease, a fluctuating trend, which means we've seen days of increasing case counts and decreasing case counts, but a total grade of substantial community transmission throughout the central region. Now things in the city look better than that. So we have now had a decreasing trend in terms of our case rates for 16 straight days. When I reported last week, we were at about 16 cases per 100,000 residents. Today, we're at 11.6 cases per 100,000 residents. Our percent positivity has been decreasing for the last 9 days. But the number of clusters, the number of multiple case outbreaks that we work up has continued to increase. Much of that is due to clusters of disease that we see in workplace settings as more and more people are returning to in-person work. We continue to see pockets, small, 1 and 2 case pockets at institutes of higher education. And then as we've also started to see, or continued to see, clusters related to restaurant and bar activity. One other trend to note is that over a third of our cases over the last 4 weeks are in that 20 to 29 age group. And so what we've been seeing as the pandemic has progressed is that younger people are continuing to be out and about and to drive transmission. One of the other major focuses of our work in the last couple of weeks has been preparation for COVID vaccine. At this point, we're still hearing from the federal government that vaccine will potentially be available in November of this year. I think we'll continue to have to keep an eye on what's happening with vaccine clinical trials and whether that timeline is realistic or not. But we are starting the work of, just this past week, connecting with our healthcare institutions and our long-term care facilities as those frontline workers and residents of congregate care facilities will be in the first priority group to receive the COVID vaccination. That second phase will expand to other essential workers who are also at high risk, people like teachers, residents and staff in jails, and then people with underlying health conditions that would put them at higher risk. And then the last phase would really open up to the general public. In preparation for COVID vaccination, we also recognize we've started flu season. So flu vaccine is starting to become available through many retail pharmacies and doctors' offices, and we are now starting our first round of public flu vaccinations. As we do every year, our goal is really to increase access to flu vaccine for low-income, underinsured communities, but we will be doing more vaccination events than we historically have, again, to build the practice and the plan around COVID vaccination as well. So our first flu vaccination that will be open to the public is on Friday, October 2nd in the Southwood community from 4 to 7. In the same way that everybody has been calling our hotline 205-3501 for testing events, would ask you to call that number for the slate of flu vaccination opportunities that will start on October 2nd and persist throughout the fall. And if you are affiliated with an organization that serves low-income or underinsured residents and want to host a flu vaccination, please get in touch with us. Call that number, 205-3501, and they will connect you to our vaccine coordinator. So that's all I have for now. Thanks.
Thank you, Dr. Avula, and we'll take some questions.
Cameron, I guess first starting off with this new announced funding, I guess for the $1 million in the CARES Act funding, how many facilities do you hope can help with this? How many additional children do you hope to find space for? And then I guess can you expand on what's creatively addressing disparities? What looks like that 500,000?
Yeah. We obviously want to get as many people into the children into the current facilities that we have. We're going to be working with RPS, but we also recognize that there are going to be some needs for some expansion, working with neighborhood providers who are already doing this work already. We want to help there, and if it's closer for a resident to take their child to a church nearby, that may be a provider that's already approved by the Department of Social Services, the Virginia Department of Social Services. We want to provide those options. I don't have the actual amount of actual spaces that could potentially be created there, but we'll find out about that during the application process. Or how many we will approve.
And then for the 500,000 for creatively addressing disparities, is this something you're accepting ideas on, or do you already have some?
So we've been working with Richmond City Health District for now a number of months since we've been within the pandemic, talking about these disparities, that whether it's underlying conditions, how we go about closing the gap. And so we're going to be working with Dr. Avula's team on what are some solutions to begin with the $500,000 that we can start closing those gaps moving forward. This is essentially about creating resiliency, right? Here's the thing, what we can always expect, there's always going to be another crisis. We hope there's not going to be another health crisis anytime soon, but another crisis will occur. And what we want to create for our neighborhoods and for our residents is that resiliency, the resiliency to survive a pandemic or any other future health crisis. The current pandemic has illuminated the inequities that we see between black and brown people and their white counterparts. And so we're going to work with their team on how we go about closing those gaps.
Chris?
Dr. Avula, you want to speak to?
Sure. So to answer the question of what might creative approaches to addressing health disparities look like, I think one of the things that we have increasingly known about health outcomes is that they're multifaceted, right? They are not just a function of whether you have access to a healthcare provider or not, but also, are you housing stable? Do you have access to food? What is your access to mental health care? And how are all those things working together? And so I think the real opportunity here is to increase the coordinated and integrated delivery of services. So there's many opportunities to look at the ways that the city is already providing services, but to do those in different locations and to do those in concert with one another. So an individual or a family does not have to go to 6 different providers to receive different types of services that ultimately are all needed for the well-being of that individual or family. So that would be one major concept. I think the other that's of interest is recognizing the need for navigation and on-the-ground community health worker support. That's something we've been invested at the health department. I think there are more opportunities to expand that programming. And then maternal child health has been long a focus of the city and of the health department. And so trying to look back at some of the drivers of disparate outcomes, particularly for African American women. Those are some of the areas that we're really focusing on right now.
Yeah, quick follow-up to that. Is this, so that money, is it something like that's kind of pay for personnel, marketing? Like, how might that money be used?
I think we're still mapping out some of those details. I mean, this is one-time funding, and so we need to be realistic about ensuring that it goes towards piloting efforts that then can be made sustainable, whether that's sustainable through ongoing revenue streams or future commitments through the city. I mean, I think this is really a season of figuring out what works and what we can continue to allocate resources to in the future beyond this one-time funding.
Yes, so just last Wednesday, you mentioned, your partnership with the two YMCA locations in the Greater Richmond area, for the emergency child care services. How has that partnership been going so far in the process with you?
I mean, I've heard nothing but good things at the moment. Obviously, we are working the quickest way possible to opening up the additional sites that are working with the schools, right? We will be allowed 100 kids per site at Richmond Public Schools. We know the need is there. So we've already filled, as I stated earlier, we've already filled the slots that were at the YMCA sites. That's already at full capacity already. So we're working as quickly as possible to get these school sites open and also expecting those sites to fill too. And that's why the neighborhood providers will be also will benefit from some of the dollars that we will make available.
Jasmine?
I'm gonna speak up, I promise.
The buses aren't driving by today and all that, so.
You talked about sending that letter to the school board. What's the holdup at this point of getting those buildings open? If the need is so high, what is the holdup you're seeing?
You know what, we don't want to reinvent the wheel. That's right, I think reinventing the wheel actually creates more of a holdup. We have a model that we know works. And we expanded after-school programming for elementary schoolers and middle schoolers with our philanthropic and our nonprofit partners. That's a model that we believe works, and we think we can replicate that right here for the emergency child care so we can quickly and safely move kids into these buildings as soon as possible. We will need the school board obviously to sign off on that agreement, sign off on the model that we know currently works, and once we get that done, we can get the kids in child care quickly.
Any idea of when that could happen, a date? Is there a projected ideal time you could see this happen?
I don't know what the date will be. My assumption is that the school board will have to take a vote of some sort to sign off on this, and it's my hope that they move as quickly as possible to make that happen.
Chris, you have another question? Yeah, so the YMCA, they had told us last week that they would only be staffing 3 of the 5 schools that the school board signed off on. The other 2 schools, do you have an idea of who might be able to staff that? Would this $1 million potentially pay for another provider to staff those school buildings if they are available?
Yeah, we're obviously in conversation with some of our partners we've used in the past for our after-school programming, partners like Peter Paul Development in the East End, just to name it one example. These are partners who we believe have a proven track record, who've done a great job for us in providing this high-quality after-school programming for our children, and we think they can do the same in terms of emergency child care as well.
I guess one follow-up to that, I know you say you don't know what rough time, but assuming once the school board signs off on that, do you know how long it would take to get that up and running once you have to go ahead from RPS? And then just checking in, I remember last time checking with Dr. Rabula, very few usages of your hotel program for self-isolation. Out of curiosity, how many people have used that since the program?
Yeah, today's September 16th. Our goal has always been, Cam, to get something stood up this month. And so we are obviously doing our best to get everything in place on our end the providers in place as well to do their job sometime this month. All we're waiting for now, I think, is getting the school board to sign off and come to the table for an agreement, which I believe they will. They've been supportive partners of ours in the past, and this is just sort of the paperwork that must get done before we move forward. So I am obviously very, very optimistic about getting something stood up this month. And, Danny.
The question was, how are things going with our efforts to help people isolate in hotels? As of last week, we had a total of 48 individuals who had taken advantage of that support and had completed their isolation or quarantine periods in hotels. So we continue to have new folks every week come in.
Overcome that initial, I guess, trepidation of using the program which you talked about?
Yeah, I mean, some of it was just, word of mouth needing to get out there. Some of it, particularly in the undocumented community, was a concern about, a government-run program and handing over information and potentially, because of the environment we're in, that's a scary thing for a lot of our residents who don't have documentation. I would say that has improved some, but mostly it is documented residents who are just in very difficult housing situations that are taking advantage of the hotel isolation program.
And you good? Jasmine, you good?
Chris, good?
All right, well, thank you very much, everybody.
Thank you, everyone. Stay safe and stay strong. Thank you.